We good, Mr. Russell?
We're good. Good evening, Warren Township. At this time, I'd like to introduce Dr. Tim Hansen, Superintendent.
Good evening, Warren families, staff, and community. As Mr. Russell said, I'm Dr. Tim Hansen, Superintendent of Warren. Thank you for participating in our 2021 Safe Reopening Schools webinar. I'm going to go through a couple of things here. I want to look at the agenda, give you an idea of kind of what to expect this evening. With us tonight, we have several participants and one of our panelists, and I will not introduce them at this time. We have President Rachel Burke, Assistant Superintendents Pam Griffin, Allison Woods, Ryan Russell. We have our Chief Operations Officer, David Holt, our Athletic Director, Marcus Clayton, our Chief Technology Officer, Kent Schroeder, the principal of our high school, Rich Shepler, our Director of School Nursing, Kim Howard, and our Chief of Human Resources, Brian Simpkins. Thank you, panelists, for participating tonight. At the end of May, I assigned several task force committees that covered the following areas: operations, whole child, in-person instruction, virtual instruction, technology and connectivity, human resources, athletics and extracurricular activities. These groups have been collecting and working on guidance that will be included in our Warren's SAFE, S-A-F-E 2021 reopening plan. Ms. Russell, if you go to the next slide, please. In this plan, we have kind of four pillars. The safety of our students and staff is our #1 priority. This drives the reopening plan. All the decisions that are being made are looked through a safety of our students and staff lens. The A in SAFE stands for academics, athletics, and extracurriculars. As you know, July 6th opens the window for our high school student athletes to begin their extracurriculars. The F stands for facilities and operations, and what we will do to ensure a safe learning environment, starting with transportation to and from school. And then it's important for us to look at this through an equitable access and outcomes lens. Not only through COVID, but through the social injustices that are taking place. It's important that we commit to providing our students and our staff with the resources they need to be successful. It's my intent to share this comprehensive plan no later than July 15th. We are awaiting the state and Marion County to enter into stage 5 before we can release the document in full. The goal of tonight's webinar is for us to share information with our current thinking that's based on the data and information that's been provided to us as of today. It's also an opportunity to collect questions from our Warren families and employees to help guide our decisions. It is now my pleasure to introduce President Rachel Burke for a few comments.
Hi, everyone. I want to thank you so much for joining us tonight and giving away your Tuesday. Before I get started, I kind of want to give an introduction as to who I am. So I am the school board president, but more importantly than that, especially for this conversation, I am a parent with children in the district. I have even had a very sick child within the district. I'm the parent of an athlete, a child who is really looking forward to practices and competition beginning up again. I'm a volunteer, I'm a coach, I'm also a referee. Within all of those roles, I am someone who, like you as parents, and like many of your children, missed out on a lot of opportunities this spring that we were planning on participating in. I'm a community member, I'm a Warren graduate, and I have friends and loved ones who work in this district every day. What I'm trying to communicate is that I'm in this boat with you. This conversation is not theoretical to me. This affects my children. This affects my friends. This affects my family. This affects children who aren't mine, who I care about as if they are. And it is through that lens that we have put all of this together. My heart is with you and with all of those kids and with all of our employees. And we have spent a lot of time and efforts doing the absolute best we can to prepare for the beginning of next year. But it's important to realize that this is our first public conversation. And what that means is that we are going to give you the data that we have now. We are going to give you the plan that we have now. But we're going to give that to you with the understanding that there is a month between now and the first day of school, and things change. Just as when we closed school in March, we originally thought we were closing for a little bit and then didn't end up reopening the buildings until coming up here soon. Because this is our first conversation and because things are so subject to change, it is important that we make some promises to you and that you give us a little bit of leeway. We're about to have children on our campus on Monday for the first time in 5 months. With that, we need to give some information and make sure that that is communicated. But the things that we tell you are going to change. But this is going to be our pledge to you, and my pledge to you. I'm going to reach out. I want to hear what you have to say. I want to know what your concerns are so that those can be shared, both for in-school, for virtual education, for athletes, for extracurriculars. What are your concerns? What worries do you have? We will listen to those concerns. We will communicate changes that we have to make to the best of our ability. But the most important thing that I want to stress is that the most important thing to us, the most important thing to the panelists on this phone call, the most important thing to the administrators within the district is that we care most about the safety of our students and our staff. The decisions that we are going to make and the decisions that are being presented to you tonight are those that put the safety of our student and staff first and foremost, and that will be the lens through which we continue on this work over the next month and into the school year. Thank you.
Thank you, President Burke. We're going to start off with sharing some information around the first pillar of safety of students and staff. And for that, I'm going to kick it to Mr. Brian Simpkins.
Thank you, Ryan. Good evening, everyone. I'm Brian Simpkins, Chief Human Resource Officer. And it's my pleasure to just walk through and clue you in on some of the current planning and our thinking and some of these essential areas in the, under this first pillar of safety of students and staff. I want to start out by talking about just health protocols in general. We're looking at the taking an all things considered approach to every step of the way in terms of both students and staff with regard to prior to coming to school and work, while you're at school and work, and even certain things that may take place after hours. So those are types of things like taking responsibility for understanding some of the symptoms involved with COVID-19, being able to self-monitor at home, and understanding just some basic awareness of what the coronavirus is, what its symptoms are, and then from there, as we all come to work and to school, some of the health protocols that are going to be in place for safety and for people's health will be things like just a consistent, constant emphasis on hand washing. In addition to understanding the symptoms, hand washing, and where hand washing isn't possible, hand sanitizer. You'll hear a little bit later on in the program some of those types of things and the availability of those pieces. That also includes social distancing, as I'll touch on in just a second. And so it also includes wiping down surfaces. It could include things, little things such as coughing into your elbow, avoid sharing common objects. And so it's going to require some due diligence on behalf of all of us. It's going to be a little different, but I can tell you that in our planning and with our thinking, as things come into focus, all these various health protocols are going to be in place, and we will be doing a full court press in terms of doing a public service campaign essentially, and educating everybody on what those protocols are so that we can be safe while we're on campus and working and learning. Self-screenings. This is a very important area. It's going to be the responsibility of students and families as well as employees to first and foremost take responsibility to self-monitor. That's going to involve training, as I'll touch on in a second. But there will be, before one even goes to work or school, there will be certain types of screening questions that one will have to answer, such as, have you any of the symptoms that I mentioned? Usually that's going to require, in most cases, 2 or more of the symptoms, and those are symptoms that really can't otherwise be explained. And have you tested positive for COVID? And questions such as, have you been in close proximity? Have you been close to somebody who has been diagnosed with COVID? So those are the types of questions that have to be asked every day. And people will need to really just take responsibility for self-monitoring, because we will, coming to school or coming to work, not being able to sufficiently answer those questions will be problematic, but we have steps in place to address that. Personal protective equipment. I know this is on everyone's mind. You will hear a lot this evening and in the future, just in general, talking about face coverings. And so that's kind of the term that we're using, because face coverings can cover a lot of ground with respect to face shields, the cloth masks, and so on. Right now, our thinking is for both students and staff that those face coverings will be required to be on hand. We will have a supply that'll be addressed later for those who either forget or maybe don't have one initially. But the expectation is that that will be required. Now, students and staff in all cases won't necessarily have to have one, but will not have to always wear it. But in situations, especially in an indoor setting where social distancing is not possible, then it's going to be required. It's going to be highly expected and encouraged that one would wear those face coverings in those situations where it's just impossible to maintain social distancing. So that would be things like riding on the bus, passing in hallways. It could be other things where, a teacher's conducting learning with students in a small group setting where masks will have to come on. So again, much more will be coming out about that, but face coverings will be a very important piece as well to keep everyone safe and healthy. Social distancing, everyone's probably heard about that. Social distancing will be strongly encouraged in all cases where possible while working and learning in our school buildings. Right now the recommendation, it's kind of fluid, but the recommendation is 3 to 6 feet. So a teacher working with students in the classroom as much as possible will try to maintain that distance of 3 to 6 feet. Likewise, desks will be 3 to 6 feet apart. That is another education piece and something that we'll all have to get conditioned to and get used to. And again, as I just mentioned with regard to face coverings, in those situations where we're indoors and social distancing, as I've described it, is not possible, then it's going to be strongly recommended and encouraged to wear those face coverings. So people will need to have those on hand at all times. Real quick, I'd like to turn it over to Kim Howard, our Director of Nursing, School Nursing, to just address our clinic space. Kim?
Kim, you're muted.
I'm sorry, I apologize. Thank you, Brian. We are following all the guidelines from the Marion County Health Department and the CDC and the Indiana State Department of Health as far as the social distancing. and providing the safest places possible for our students. When it comes to the clinical space within the school buildings, the nurses' offices will be operating as usual, with the exception that those students that will frequent the nurse's office will be those students that are there for daily medications as well as injuries and so forth. Any student that presents with symptoms of illness throughout the school day, we will have a separate screening room that will be manned by a trained staff member to facilitate and help to get that student home or back to class, whatever the case may be.
Mrs. Woods, do you want to talk to us a little bit about the training that will take place for students, specifically about what some of the safety protocols will be?
Absolutely. So, one thing that we've really talked about, in addition to the physical safety for students and staff, is also social emotional. It's going to be a big transition coming back to school. I know for my children who haven't been many places outside of our house and our street, there's going to be a lot of new experiences that they're going to have going back to school. And so we're going to be doing a number of different things to make sure that our students feel comfortable, feel safe, know that they're safe at school. Talking about having some closure activities. The year ended suddenly last year, ended pretty quickly. So having some closure activities, and then also, relationship building with their new teachers, but talking about and being really intentional about teaching lessons about washing hands, why it's important to wash hands when we do that, why one might need a face covering, and how to wear those and how to safely store those, what to do if you're feeling sick, what are things that you need to be paying attention to, and then how to report those. And we're also going to be providing additional training to teachers as well as to how to have some of those conversations with students. If students are having anxiety or worries, how to be able to navigate those conversations that are going to be new for some of our teachers and all of our teachers and students, so we can make sure that both our families and our students and staff know that the kids are safe at school and know what's expected of them as well.
Thank you. All right, moving on to academics, athletics, and extracurriculars. I'm going to kick us off with the academic side. So for academics specifically, I know Mr. Simpkins spoke specifically about social distancing within the school environment. Specifically for us, what that means within our classrooms is the very unique and what I would call the traditional arrangement of desk and rows in our classrooms. We've taken great efforts to evaluate both the sizes of our classrooms with enrollment projections, to make determinations that desks can be spaced between 3 and 6 feet apart in classrooms, all facing in rows, all facing in the same direction, to allow ample space for students to both enter and exit, and then teachers still to have room to function to teach face-to-face instruction within the traditional learning environment. Remember, the PPE use, or face covering use as we referred it to, would take place in the event where students wouldn't be able to be appropriately social distance. And we'll get into more to that later, but through several scenarios, if you look through our traditional school days, some of those opportunities will certainly arise. Other aspects specifically within the school day, as far as taking appropriate social distancing steps that we're looking at, is everything from hallways and passing periods to cafeteria times to buses and entry and exiting the school. That we're all taking specific actions, coming up with directional signage and other components that will certainly provide a level of support for our students as we all work towards that social distancing and classroom structure setup. Obviously, there's been some additional communication, and as you guys have been submitting questions, there's a lot of interest in our virtual program. Just to make it clear, we will offer all families the option to have traditional face-to-face instruction or virtual learning. Those families will be able to determine that in whatever they're most comfortable with as we release as we release additional details of the plan. Families will have the opportunity to indicate which one they feel most comfortable with. To give us some more specific information on what our virtual program looks like and some of those components, I'm going to ask Mrs. Griffin to take it over.
Good evening. For the fall of the 2021 school year, we will be offering a virtual learning option to our families that will allow their students to receive their instruction at home using technology. Students will have a schedule, attendance will be taken, and it's expected that they report to their classes on time because their classes are being taught by Warren Township teachers. There will be instruction, there will be projects, assessments, classroom discussions, grades, and feedback. And virtual instruction will follow our district curriculum maps. Again, all of this will be done at home using technology. Because of the structure and the nature of virtual learning, all students must commit to a minimum of 9 weeks of attendance in the virtual learning program. There will be training to support students and their families to help them learn and use and understand our learning management system called Canvas, because we want to make sure they can access school every day. We know that because we are blessed with a robust offering of courses at Warren Central High School and throughout our K-8 programs, that there are going to be some unique situations. And so I just want to let you know that we're committed to working with our families. We know that there are going to be issues that, and I shouldn't call them issues, they're going to be unique opportunities for us to really support our students to help them get their educational needs met. And we look forward to having those conversations with our families. Upon our return from the holiday weekend, the week of July 6th, Warren Township is continuing to enroll their new families to our new families to Warren. And we're also going to begin taking information from our already enrolled and returning Warren families on their desire to opt in for virtual learning for the upcoming school year. And at this time, I'm going to invite Marcus Clayton, our athletic director at Warren Central High School, to share more information on athletics and performing arts.
Good evening, everyone. Just want to share some aspects of what to expect this Monday, July 6th, as we reopen our extracurricular activities. And this consists of athletics, as Ms. Griffin indicated, as well as performing arts. I know our kids have been itching at the bit to get restarted, as well as many of our adults. But as a proud parent of a 2020 Warren Central grad, who's getting ready to head to college, just understand, as Dr. Hansen stated at the beginning of the program, we've been working hard for the last couple months. And one of the biggest challenges that we've had as a team is exactly how are we going to integrate our extracurricular activities while at the same time make sure that we do it in a safe way. And I'm proud to say that as a member of this team, that all of us collectively, we're going to make sure that we put the best interests not only of our students first, but of the adults that work with them first as well. So as we look at this process, first we start with the pre-participation guidelines as stated on the slide. And what we're looking for is prior to this Monday, which again, this is going to be a challenge, and we're very aware of this, and we're going to work with our parents, we're going to work with our coaches, and we're going to do what we can to make sure we get these things in place by Monday. But if we have to start practices a little later in the week, we'll do so. But we want to make sure we have these things in place, starting with our student athletes. In order to participate in these activities, if you're a student athlete as well as a student that participates in performing arts. Actually, let's start with the athletes first. First and foremost, you will need to have a athletic physical on file. If we don't have a athletic physical from the 2019-2020 school year. So back in April, the IHSAA, which is the governing body for athletics, indicated that if you have a 2019-20 physical on file, then you will not need to renew your physical for the following year. In other words, a 2020-2021 physical. That is correct. But if we cannot obtain a proof of that 1920 physical, then yes, indeed, you will need to provide a brand new physical to us. If it's a transfer student and a copy of that physical is not received to Warren Central or to one of our middle schools, then again, we will need to have a new physical. If you have some type of pre-existing condition of some sort, some type of medical condition, this year the IHSA has included the 2020-21, what they're calling the health history update. The health history update consists of 7 questions, which will ask you about your health history. Every student athlete is required to complete this form, which is number 2. Your student will complete this form, and if you answer yes to any of these questions, then you will be required to complete a 2020-2021 athletic physical, updated physical. Again, that 2020-21 IHSA health history questionnaire and consent release, every student athlete will need to complete this form. And if you answer yes to any of these questions, then you will have to complete a new physical for this upcoming school year. In addition to that, number 3, you will have to submit a current 2020-21 IHSAA concussion, as well as a sudden cardiac arrest acknowledgement and signature form. This is state law. We can't get around that. Again, the concussion and the SCA, or the sudden cardiac arrest acknowledgement and signature form, must be signed off by the parent and the student before your child will be allowed to participate. 4, the community health, the 2020-21 version of the community health consent and HIPAA privacy form must be completed as well. Again, the community health consent, HIPAA, and privacy form must be completed as well. If you are new to Warren Central, this is number 5. Again, this is only for students that are new to Warren Central, which at this time of the year, we tend to get our transfer students. Then you will need to complete an IHSAA transfer. But before you can do that, you must be enrolled. Once you are enrolled as a new student to us, as a parent, or a student, you will need to set that meeting up with me, Mr. Clayton, in the athletic department. And this only applies to high school students. And we will do an athletic transfer. You will not be allowed to practice until that athletic transfer has been completed in the athletic office and it is signed off by the IHSAA. Now, new this year, we have our COVID-19 training. Our COVID-19 training. We are requiring that all of our student athletes, as well as our performing arts students, complete this training. And I want to thank Kent and Brian Simpkins, as well as Ryan Russell, for making this happen in a very short time frame. But as long as you have access to a Warren Central email, you will be able to complete this training. It's about a 10-minute training. And I went over this with the head coaches yesterday, so they will be able to guide you through this process. Our parents, as well as our student athletes. It's about a 10-minute training. You'll go through Safe Schools to be able to log in. Once they complete that training, they'll have to provide proof that they completed that training, and the coaches will be able to guide them through that process again. They'll submit that certificate to the coach, which will come to the athletic department, and they will be finished with that. But all students that participate in extracurricular activities will have to complete that process. They'll need to complete that training. The second new and the final thing for student athletes is the Warrior Acknowledgement and Pledge. And that Warrior Acknowledgement and Pledge is new because it is a partnership between the Warren Central or Warren Township, our parents, and our students. Because as we go into this most challenging year, we understand that this isn't just about what can the school do to keep your students safe, or what can the parents do, or what the student can do. This is a partnership. And that partnership consists of us working together, and just like it says behind me, as a family, what can we do to work together to prevent and stop the spread of COVID-19? And we're all going to work together collectively to make sure we provide the safest environment for your student, to make sure that we learn how to properly sanitize, as Mr. Simpkins said, following those guidelines laid out by the CDC. If we're not feeling well, to make sure that we take those self-assessments, to make sure we do everything that we can to create the healthiest environment each and every day that we walk into those facilities. That's what that pledge is. So those are the things for student athletes. For our performing arts students, they will also take the COVID-19 training, and then they will complete the War Acknowledgement Pledge. Again, a lot more. It's pretty simple for our performing arts students. They will do the COVID-19 training. Again, if they have a Warren email, they'll have access to that. And Mr. Meckes will meet with the performing arts parents tomorrow, and he'll show you that process. And then they will also complete the War Acknowledgement Pledge. Okay? That is the pre-participation expectations for our athletes and our performing arts students. Now, the training aspect of it, understand that we have it broken up into 3 phases. What we are most concerned about, and again, we are a district that are going to put our students first. And we understand some of the other dynamics that are behind this, but if we had it our way, we would push this process back another month or so, because we understand that a lot of our kids haven't had access to have the ability to train. And when they come back to us Monday and they're expected to prepare and compete in games in about a month, the opportunities for injuries and things of that nature increase tremendously. So when we come back in what we're calling phase 1, and we'll go over this in much more detail later, and please email me your questions later. But when we talk about phase 1, which is starting Monday, and that will go from July 6th to July 19th, those first 2 weeks, and this also applies to our performing arts students, those coaches will only be allowed to work with those students for 15 hours those first 2 weeks. Week 1, they'll work with them for 15 total hours. That's it. We're going to bring those kids back slowly. Again, we're going to do what's best for our kids. And then that second week, they're going to only work with them for 15 hours. Once we get to phase 2, which is July 20th, July 20th through August 15th, then we'll go back to our traditional summer rules. All right. Phase 2 is July 20th through August 15th. And as you guys know, we're scheduled to start school July 29th. So traditional summer rules will only apply for a few days. But with that being said, it's going to be a gradual rebuild. And then what we're calling phase 3 will start August 15th. And that's when our actual competitions will begin, where we can actually start playing games. So this is going to be a slow process. We're not going to do anything that's going to jeopardize the health and safety of our kids, because again, this is a fluid process. And as Dr. Hansen said, it can change as we go. We already talked about the pledge. And the one thing that you'll hear all of us say over the course of this summer and over the course of this year is culture change. A lot of what we're doing is going to be a culture change. The way that we have done things, the way that your students are used to doing things, and it will start this Monday from the time they get out your car. It's going to be a culture change, and it will start with the way they approach practice and workouts. And that will start with our pre-activity screening. Whether you are an athlete or a performing arts student, whether you are in the middle schools or if you're at the high schools, you will have some type of pre-activity screening. And that process will consist of either a coach or an athletic trainer from Community Health Network. They will assess you, they will screen you, and it will consist of taking your temperature. And Mrs. Howard already talked about some of those things that will go into that. And they'll share more details with that. But we'll check temperatures using an infrared thermometer, a no-touch thermometer. We'll ask questions as it relates to any contact or any connections with COVID-19. Again, fevers, cough, shortness of breath, sore throat. We'll go through that whole matrix. We have that all drawn out. We'll track that. We're going to use that information. We have a process in place if any of those symptoms are found. As Ms. Howard indicated, we have screening rooms set up. We have a contact system where we will get in contact with you and information that we'll share with you as far as contacting your primary care physician. We're going to make sure that we put communication first and foremost and work with you in the event that your child is not feeling well. That is going to be important. And we're going to work with our coaches to make sure they understand what that process consists of. All right. But that will start first thing Monday morning. And that will require for you to drop your kids off, and our coaches will communicate that with you. They'll have to arrive to practice anywhere from 30 minutes to 1 hour before the start of practice in order for us to be able to execute this. Okay. And then the last things, materials and equipment. And that's something that, again, your coaches will talk to you about. But water bottles, something as simple as that. Our students will be required to bring their own water bottles. They'll be required to bring their own water bottles because the days of sharing water, the water trough systems, we will not be allowed to do that. They will have to bring their own water bottles. We will not share equipment. Mr. Meckes will go over that tomorrow. We will no longer be in a position where we can do that. They will have to come dressed appropriately because during that first phase that I talked about, during July 6th through the 19th, they will not have access to locker rooms. Locker rooms will be closed. And depending on where we're at, because again, this is a fluid situation, that may be extended beyond that first phase. So when we say come dressed appropriately, there will be no showers at school. And again, just talking about that culture change, those are the things that we have to be prepared for. But the one thing we promise is that we will communicate with you. We will overly communicate with you, and we'll make sure that we keep you in the loop. Thank you.
Thank you, Mr. Clayton. Moving on now to our third pillar, facilities and operations. I would like to introduce Mr. David Holt.
Thank you, everyone. My name is David Holt. I'm the Chief Operations Officer. And since March, we've been hearing from our medical experts that the best way to prevent this, and you've been hearing it all night, is social distancing, washing your hands, and then cleaning and disinfecting highly frequently in high-touch surfaces. And it's going to be important for us as we identify different ways to clean, keep things safe. Specifically, classrooms, hallways, school buses, other highly used areas are going to go daily deep cleanings, not just at night. They're going to have to be done during the day. Specifically as we think about high touch surfaces, those will need to be cleaned and sanitized throughout the day, such as doors, handles, desks, chairs, handrails, sinks, counters, tables, student desks, in-room cubbies, other hard surfaces on the floors. And then throughout the day, restrooms, the nurse's office, the main lobby of each school building will need to be cleaned and sanitized throughout the day. If we're going to use the cafeteria to serve food with students in them, we'll have to clean each table after each lunch group has been finished. Main entrances, walk-through security areas will also need to be cleaned and sanitized throughout the day. To help with individual classrooms and high traffic areas, we're trying to create sanitation stations. And what does that mean? We will be providing hand sanitizer, disinfectant spray bottles, microfiber towels, and other types of effective cleaning solutions in classrooms and high traffic areas so that we can monitor and clean not just once or twice a day, but all day long. We are also looking as if we are going to be going out and utilizing at the elementary level our playgrounds. Playgrounds and outdoor equipment will need to be sprayed each morning before recess begins to make sure that those are appropriately clean. As we think about transportation, drivers are going to be expected to wear a mask at all times students are on the bus. Students will have assigned seats every day. We will need to work with each school building and their principal and their administration to appropriately develop unloading and loading of students so that we can try to maintain appropriate social distance. And while we are transporting kids and while we're en route, we will use windows being down when appropriate. As we think about feeding kids, it's always an important process here in Warren. We are a CEP district, which means all of our students receive free breakfast and lunch every day. Last year was the first year for that. All of our K-8 students ate breakfast in their classrooms. We envision that process continuing this next year. We will be working with our school administrators to develop the appropriate way to distribute lunch. We anticipate in the beginning a grab and go option, much like we've been providing since March, since we left school, in providing grab and go options to make sure kids have access to food on a daily basis. To lessen human contact and handling of cash, we will not be offering a la carte items at the beginning. And then all utensils and condiments and other, in the past, high-touched products will be individually wrapped. To help with access to drinking water, since the state of Indiana has encouraged water fountains to be shut off, we will be offering bottles of water throughout at breakfast and lunch, and then we will be creating water stations in each building that we will be using as refill stations to make sure that students have appropriate access to water throughout the day. Signage is going to be important. We are working with our print shop, outside vendors to create different types of signage. Signage as you come into the building to make sure that you are fully aware of the symptoms and the self-monitoring things that you need to do before entering. We will have hand washing signs in every bathroom and in hallways, and then social distancing signs, and then stickers on floors will be placed all throughout our buildings to make sure that we are communicating and educating our kids to the appropriate way to prevent the spread of this virus. Next, I'd like to ask Kent Schroeder, our Chief Technology Officer, to talk about devices in our technology plan.
Thank you, David. Good evening, everyone. I want to start by reaffirming our commitment to providing a device for every student. That makes it very important that every student that took home an iPad or a Chromebook in the spring returned to school with it, and the charger and the case that came along with it. We also encourage them not to share devices with other students. If your student's iPad or Chromebook does need repair work, we have a support at the Walker Career Center main door, that's door 70, on Tuesdays and Thursdays from 11 a.m. to 1 p.m. until the beginning of school. Now, students on campus, once school resumes, will continue to receive their technology support in their usual manner. We're working on details, however, but we will also have service hours available for students that select virtual school. The locations and times are to be determined, and we'll announce that as soon as it's available. Finally, we will have options for students that select virtual school and are in need of reliable internet access. And again, that's something we're still working out the details on, and we'll announce those details very soon.
Thank you. And our final pillar, equitable access and outcomes. And we're going to start out with Mrs. Woods.
Hi, I'm very excited to share with you guys that we are going to be opening the Moorhead Community Resource Center this fall. As part of our strategic plans, it came out that this was really a need for the Far East Side to have a place that we can offer services and supports to our families and community to be able to connect them with services and opportunities that they need. Sunny Day will be moving over to Moorhead, hopefully late August to mid-September, so we can connect families with that resources as need. But you also see some adult education classes happening there. Our mentors that work with our students in our community, lots of activity happening there, but also lots of resources that we're going to be able to better connect our families with, and a navigator to help navigate some of those difficult systems. You know, we've been in this unique and uncertain time. Families have some additional stress and needs, and we are going to do our best to help meet those, not only in this time, but moving forward in Warren Township. I'm going to turn it over to Rachel Burke. Oh, Ryan, can you bring the PowerPoint back up?
I'm going to briefly discuss food outreach. We know that during shutdown that we had food outreach that was very, very valuable to our families at multiple sites. That food outreach will continue at satellite locations throughout the district when school opens back up. Also, those students who are attending virtual school will still have the option of receiving food. It will probably not be able to be delivered to you, but we will probably have, like Mr. Holt said earlier, some sort of grab and go option so that we can make sure that those kids are still being fed and receiving nutritional support as well. I'm now going to kick it off, I believe, to Mr. Hanson. Dr. Hanson?
Thank you, Rachel. One of the things that we instituted when COVID-19 first took place was an outreach hotline, both a phone number and an email address that allowed our families to communicate with us what their needs were. Many of those needs were food related, but as we know, many have either been laid off or have lost their jobs. So we anticipate that some of those needs are going to be greater than they were in March, or that some of those will still exist. So we will continue to offer that outreach hotline. We'll continue to share that with our families as those needs come available. Please communicate those with us. And as Mrs. Woods mentioned, our Moorhead Community Resource Center will help facilitate meeting some of those needs. I'll mention the internet access before I turn it back over to Mrs. Woods, but you know, Mr. Schroeder mentioned that connectivity is very important for us, even for our students that are coming back in person. We know that there's a possibility that school could be disrupted for a small group of students or us as a school or a district, not knowing what the future holds with a second round of COVID or what might happen when fall and winter come. So it's important for us to know how our families, or if our families have internet access and connectivity. We are working on funding for additional support in that area. We have purchased several hundred and thousand internet access hotspots that we will be deploying to families who need connectivity. So that's important for us so that all of our students have access to that, as well as our staff. Mrs. Woods, could you talk to the adult education and speak on the exceptional learners?
Sure. Adult education classes are going to continue. So for our families that have been involved in that, that are getting their HSE, that are working on some of the certification programs. Those are going to be both virtual and in person, and starting back up here in July. So please reach out if you have questions about enrolling in those and those opportunities that may be available. As far as exceptional learners, we know that our exceptional learners, which includes our students that are special ed, that have IEPs, our students with 504s, our students in our high ability and Excel program, our English language learners, all have unique needs that we want to make sure are still addressed both in an in-person and virtual setting. So no matter if you fall into any of those categories, you will have the opportunity to be served and get services in both of those settings. We will have for our students with IEPs and 504s and our English language learners, for families who choose the virtual option, we will be having case conferences or meetings to determine what services need to look like for your child so they can progress with their education. And we are also taking extra precautions for at school, making sure that our teachers are pushing into the classrooms rather than pulling students out, and making sure that we're not sharing materials, additional hand washing, being cognizant of not grouping kids across classes when at all possible. We will be still having case conferences. As we have been doing, we are going to ask that if families want to participate in those virtually, just for safety of fewer visitors and to help social distancing in a conference room, that we can continue to do that. And we will still be having evaluations and taking requests if you have concerns about your students. So we will have both in-person and virtual service delivery options as well for our virtual families. So we're really hoping to be able to meet the unique needs of all our learners in whatever platform they choose. I'll click it back off to Mr. Russell.
All right, thank you guys. We've now entered the time of our webinar. We'll address several questions that have come in. First and foremost, I want to send my thanks to the numerous questions that have come in over the past week. What we have tried to do is organize those into the most frequently asked questions, and we'll start running through those and giving our responses. Some of those will be repeat information of what we already shared, but will allow us the opportunity to clarify some additional points and details. Just a reminder for everyone, while we might not be able to live answer all the questions that are currently being submitted, putting those questions in the Q&A tab on this webinar allows us the opportunity that if we're not able to respond tonight, that we will be able to follow up with additional guidance either through the plan or directly to you. So everyone who's watching the webinar, there is a Q&A tab that you're welcome to submit additional questions or feedback to. Just know that we may not be able to get to all those tonight. So as we organize the questions that have come in over the past week, we certainly have a lot of different components that'll go on, and we're just going to kick that off right now. So I'll ask the question, and then I will certainly reintroduce the person that will be addressing that. So starting off, our first question frequently that came in is, I'm a parent with a child that has a compromised immune system, just seeking guidance on if they will safely be able to return to school. So I'm going to ask for Mrs. Howard to address that one for us.
Thank you, Mr. Russell. Of course, we are reopening under the best and safest practices and guidance from the CDC and the State Department of Health, as well as the Marion County Health Department. Any parent that has a concern about their specific student that would have a compromised immune system or a chronic health condition that would cause them uncertainty, we would suggest that you confer with their healthcare provider and ask for their guidance and assistance in directing you the best way for your child to continue with this school year.
Thank you. Moving on, some questions about breakfast and lunch being available for students. Several people inquired just about with some of the increased traffic and that if we would still be able to provide breakfast and lunch to students. And then to take it a step further, would breakfast and lunch being provided for students who opted for the virtual option? Mr. Holt, would you mind addressing that again for us?
Sure. Absolutely. Breakfast and lunch is a priority for us for all students, whether they be virtual or face-to-face. Granted, face-to-face will be in their building, whether it be in their classroom or some sort of modified structure within the cafeteria. We are working with building leaders and district administration to try to understand the safest and best way to provide both breakfast and lunch. Last year, as I said earlier, K-8 ate breakfast in their classroom. We envision seeing that occurring again this year. At the high school, breakfast was served in the main cafeteria. We envision having to create breakfast in both cafeterias to make sure that there's appropriate social distancing. And then as I said, lunch is still an ongoing process. We're going through multiple options to create flexibility to make sure that we're doing it in a safe and concise manner. But again, I want to emphasize that all students, whether they are face-to-face or virtual, will have the option to have a lunch and a breakfast each day. The virtual option will probably be through some sort of satellite where you will have an opportunity to come into specifically assigned schools to pick up both breakfast and lunch.
Thank you, Mr. Holt. Moving on to the next question, I am going to ask Mr. Butler, principal at Hawthorne, will I be able to volunteer in my child's classroom this year?
Thank you. In the classroom, not at this time. We're taking every precaution to ensure safety, and controlling the number of people in the building is high on the safety list. I'm confident that schools and teachers will find innovative ways that families can support the classroom from home. We appreciate your support, and we want to support your first goal, which is to keep students and staff safe. So not at this time.
Thank you, Mr. Butler. Back to Mrs. Howard. When should I keep my child home from school? Is there any guidance specifically on, as a parent, what some protocols are for keeping my child home from school?
Kim, you're muted again.
Oh, I'm so sorry. Thank you. So sorry about that. As we talked about through this entire discussion, we're going to do our best to have, our students and staff, be monitoring themselves of symptoms, but for parents to be cognizant that if their child has a fever of over 100, a severe cough, a sore throat, chills, unexplained vomiting or diarrhea, any sudden loss of taste or smell, redness of the eyes with drainage. Those are some of the key factors for keeping your student home. Same things would apply if your child should become ill at school. Those are some of the same symptoms that we're going to be screening for and be on the lookout for and monitor for while our students and staff are in our buildings. With that being said, it's going to be very critical for our parents to keep in contact with the school, any updated medical emergency information and contact information, so that if something should occur with their student during the school day, we have the most updated information to be able to contact that family readily.
Thank you, Mrs. Howard. I'm going to address several clarifying questions on face coverings. Will my child have to wear a mask at school? Know that the guidance that we've received from the Marion County Health Department combines the use of face coverings and social distancing in the same category. As we've tried to communicate, there will be times when face coverings are required, meaning that when social distancing can't be expected. So for example, in a cafeteria line, in a passing period, on the bus, While we certainly have plans to reduce the capacity of our buses and lower class sizes through students choosing virtual options to allow some more space and room for our students to be in face-to-face instruction, not every single opportunity throughout the entire school day will permit for 3 to 6 feet social distancing. So they will be required when that social distancing is not able to be achieved. However, when they're able to be 3 to 6 feet apart, we will not require the use of a mask to be on for the entirety. Again, that comes with the direct recommendation from the Marion County Health Department as far as the consideration being made for that current thought or current train of thinking. I'm going to go back to, it kind of goes hand in hand with that, but back to Mr. Butler. Are kids going to be required to social distance in a classroom?
Thank you. I think it teams really well with what you were just saying. Yes, as much as possible, students and staff will be given the ability to social distance 3 to 6 feet. We'll have the signage out. We'll have the stickers on the floor. We'll try to watch how we set up classrooms. But when social distancing is hampered or we can't get it the way we need it, then students and staff will be able to use those face coverings you were just talking about.
Thank you, Mr. Butler. Going to Mr. Simpkins, obviously we have several employees and staff members watching tonight. I'm a staff member who has some concerns about returning to work. Who should I talk to about my concerns?
Yes, thank you. Understandably, we may have employees who have a health condition that may put them at risk or compromise them medically, or that of a loved one in your immediate family or in your household. And so I just want to make it clear tonight that for all staff to feel safe, to be encouraged to approach your supervisor and or to contact me and begin a conversation. I am very interested in addressing your concerns and having a one-on-one conversation to get the ball rolling on your specific situation, because I'm going to take all of those situations and taking all things considered, look based on the facts on a case-by-case basis. So again, I strongly encourage all staff to reach out to myself and or your supervisor as early as possible so that I can help address your questions and concerns.
Thank you, Mr. Simpkins. Moving on to more questions specifically about social distancing. And what I would say, we fully realize that not every aspect of the school day will allow for students to be spaced 3 to 6 feet apart. One of those examples someone has specifically asked about is a passing period. Mr. Shepler, would you mind talking to us about, obviously we know students can't exactly social distancing during a passing period, but your current thoughts on just what that process will look like, from face coverings to how you're going to work with students about that.
Yes, thank you, Mr. Russell. We are obviously, when we're moving 3,000 plus students 7 times a day throughout a high school that under roof, it is 1 million square feet. Those 1 million square feet get used up pretty quickly. So when they are passing from class to class, it is the expectation that they will be wearing face coverings. So those will be required because social distancing cannot occur at that time. Mr. Holt said earlier in regards to directional signage and guidelines that those will be posted on walls, on floors, as you probably have seen in grocery stores. You see the markings on the floor where you are walking on this side of the aisle. Those will be posted as well, because we want our students to be walking on the right side of the hallway, just like, you know, car traffic. We want to make sure that, you know, on both sides are utilized and going in opposite directions, so that there isn't a cross with our students. Also, speaking of traffic, looking at traffic circles within the building. As you see these on the roads nowadays, utilizing a traffic circle in our main high volume areas, such as the Commons or intersection A and J in the Freshman Academy, utilizing a traffic circle set up with stanchions and getting kids familiar with, always moving to the right, wherever whichever hallway you need to go through. Also, making sure that teachers are having strategic dismissals from their classroom each period. Don't just let the whole class get up and head to the door. We're going to stagger those out so that students aren't all jumbled up right there at the exit of the door. Also, it is imperative that our staff, every one of us, are to be out in the hallway, educating, supervising, and directing traffic flow, because our expectations with students, there is to be no stopping, standing, or congregating throughout the hallways or commons areas. And it's just imperative that we all work together in this process, for the health and well-being of not just our students, our staff, but our students and staff families at home and our community. So it's going to be we've all heard this, unprecedented times, but we all have to work together, and we can get through this.
Thank you, Mr. Shepler. One more for Mr. Simpkins. Mr. Simpkins, what happens when someone reports symptoms of COVID-19?
Yes, thank you. Above all, no matter whether you're a student or employee, when it comes to this matter, just know that we will be extremely diligent with the communication, because communication is going to be essential, whether it's a scenario where one has, through self-screening and self-monitoring, determined that they do in fact have the symptoms, or whether it's a situation, again, as a student or staff member, where symptoms emerge while on the job or while in class. We have a number of steps and protocols that will be in place, and it'll require, again, a lot of training and communication to ensure that symptoms are identified, and that we are able to provide direction and advisement to both students and families or an employee. Again, if it's before the school day, there'll be contact made and further guidance provided, because there's several scenarios that I can't get into tonight, but that may involve either being directly exposed to someone who was positive. And you may have symptoms or not symptoms, both outside of school or in school. And so we will definitely address each of those various scenarios. But as we alluded to earlier this evening, with students and staff, we will have a designated screening room whereby we will be able to have trained people identify whether or not the symptoms are present, symptoms that can't otherwise be explained, and be able to give a student a chance to rest, to monitor them briefly, and then from there, it's a decision as to whether or not one will go home. And once an employee or student goes home, then from there, the ongoing communication and advisement will continue with regard to potentially what documentation you would need, what steps you would need to take, and so on. So we are ready to further train both our families and students and all our staff on those specific steps for various scenarios.
Thank you, Mr. Simpkins. We got to run on virtual learning questions. So Mrs. Griffin, unmute. We're ready for you. So let's start off with let's try to go sequential here. So can you talk to us a little bit about, we're using a lot of different terminology now from our previous experience from March. We have learn at home, we have e-learning, we have virtual learning. Can you describe the difference between what we say when we mean virtual learning versus what our students, parents, and community's experience was with Learn at Home or e-learning last spring?
So virtual learning will look very different from the e-learning experience that we had in the spring. As you guys can recall, in the spring, our students suddenly went from face-to-face instruction in their classroom settings. We had Learn at Home in K through 8, and then we had e-learning with 9 through 12. And those environments were supported by their classroom teachers that they were already scheduled in. When selecting the virtual learning option, what you're saying is that I am selecting to go to school online from my home using technology. And just like the things that we do in the brick and mortar schools face-to-face, where we are relationship building and we are learning procedures and we are learning how to be successful in our new environments, those things will be happening in the virtual learning school 5 days a week. That's why it's a 9-week commitment, because our curriculum's parallel because of our curriculum maps. But with that being said, in the classroom setting and the virtual setting, they just can look a little bit different. And so it's really important that as our families are thinking about these options, that they are, fully aware, because we know that this is something that our families want, that it is, whether you're at a school here in Warren or you're attending a virtual school here in Warren, our students will have schedules, attendance will be taken, tardies will be recorded. Because of consistency and coherence in regards to making sure that we're meeting the needs of all of the students, we want to make sure that the person that they, especially during stressful times, the person or the team of teachers that they have surrounding them during this time are the ones that they build strong relationships with, so that we can make sure that they have a successful start to this school year, because it's going to be challenging all around. And we also want to make sure that our parents have a successful start to the school year, and our caregivers, because whether you're returning to face-to-face or virtual, this is a year of tremendous support, and we want to make sure that whether it's 5 days in a classroom with a teacher or 5 days online with your virtual Warren Township teacher, that we're meeting all of those needs to the best of our abilities.
Thank you, Mrs. Griffin. And just to clarify, as questions are coming in, just speaking out, our virtual and face-to-face options are both 5-day-a-week options, meaning that based on our current thinking to reopen on July 29th, families will have the option to choose virtual or choose face-to-face instruction. There is some questions that are coming about to the specifics. If I can switch back and forth, we'll address those in some more detail. But for the initial first 9 weeks of the school year, we are asking for a full commitment to one or the other in our planning process right now. Speaking of that virtual aspect, I want Mr. Clayton to take this next one. Mr. Clayton, there's a lot of questions. If I, as a family, or I'm a student and I choose the virtual option, will I be eligible to participate in athletics and extracurriculars?
That question is quite honestly up to the Indiana High School Athletic Association, but understand that as a district, Warren Township, we fully support the options that we present to our families. But again, the governing body for athletics and the sports that fall under that umbrella are governed and determined by the Indiana High School Athletic Association. So with that being said, this past Friday, Rule 18.7 was amended by the Executive Board of the IHSA, which in essence provided an application process for families to pursue the opportunity to gain full eligibility if they chose what they classify as a virtual at-home or at-home learning option, and still have the ability to participate in athletics and gain that full eligibility. So there's an application process that will go through the Indiana High School Athletic Association that potentially will allow that student athlete to take classes from home virtually and still be eligible. And again, that's the term that they use, virtually. However, we cannot guarantee you, because it will be taken in by a case-by-case basis, and that determination will be made by the commissioner of the IHSAA. So we will provide you with the information so you can go through the process. However, we cannot guarantee you that. I will tell you this, that the conversation has been ongoing and pretty much daily between Dr. Hanson and Mr. Russell and myself, and we will provide the best opportunities for your son or daughter to be in a position to potentially earn full eligibility through the IHSA. But at this time, we cannot guarantee you. The only thing we can guarantee you is that there's an application process that you will have the opportunity to earn that eligibility.
Thank you, Mr. Clayton. Moving on to some Mrs. Woods. Several questions came in previously about a child who receives special education services, but they are interested in a virtual option. How will those students be getting services? The specific one I'm looking at right now asks about speech. My child receives speech services and is going to, I want them to attend the virtual option. How will they get those speech services? Can you address that?
So we will make those decisions on a case-by-case basis with the parent at a case conference. For our virtual students, there will be both an in-person or an all virtual option, and we'll discuss that at the case conference to determine what the best needs are, what meets the needs of your child best. We will have a center-based option where students could come in for speech, occupational therapy, so even some resource support, or if families are not comfortable with students coming in at all, they can do that via teletherapy through Zoom, over the telephone, with their speech language pathologist or other therapist.
Thank you. Several questions that came in tonight about before and after school support and services. We fully plan to have continue our partnership, obviously, with the YMCA for before and after school care. In fact, we're running a small summer program now at our early childhood center as we practice everything that we're talking about tonight in terms of social distancing and enhanced cleaning and PPE use. Those specific details will be included within the formal reopening plan of exactly what that looks like. But as a parent, if you choose a face-to-face option, you will still have that ability to sign up your son or daughter into that program. A lot of questions, again, just specifically about registration. Where will I be able to indicate that I want virtual learning? A couple ways I would respond to that. First and foremost is Dr. Hanson communicated in previous messages that if you were previously a Warren Township student, there is no re-enrollment or registration process you need to participate in this year. So all those students have been rolled over to the appropriate grade, and we're taking care of that. If you're a new student, we've had summer registration centralized spots set up throughout June. They're not taking place this week, but every Tuesday and Thursday we have additional locations available for that we'll send out some additional information on times and locations for you to do. Our plan is starting next week to give parents the ability to indicate that if they do want to go virtual, to start to indicate that preference. That process is important for us within our planning. So as we determined several components as far as quantity of staff needed and staffing and other components to that, we're going to start that process, but that process will be available throughout the entire month of July. I want to go back to a virtual question, which alludes to potentially a student attendance related issues or anything related to COVID. If a student is in Mrs. Griffin, this is for you. So stay with me. If a student is in face-to-face learning, but they are required to quarantine even though they're not sick, how will we support that student? Will we just automatically put them in virtual, or are there other supports that we'll put in place?
So for face-to-face students who would be required to quarantine or should have an illness that would last several days, they would be able to continue their education when they're feeling well within their own classroom setting. With the use of Seesaw and Canvas Learning, our students have access to their activities that are being done in the classroom, and our teachers have really worked hard to become better with this new technology that we're learning about so that we can better meet the needs of all of our students. And so because you have that relationship with those classroom teachers and you're in their classrooms, they are going to be able to better support you during that time.
Thank you. Continuing on, back to just some additional questions about sanitation practices. So Mr. Holt, I'm going to toss this to you. Just about daily routines, just what kind of, what can we expect, whether it be from our custodial crews versus the type of efforts that we all will be taking to help sanitize areas. I know you spoke of this earlier on in this presentation, but can you talk more about sanitation protocols that we're establishing?
Sure. It'll be important that in all high-touch areas throughout all of our buildings are cleaned and sanitized throughout the day. It's going to create a significant increase in our custodial operations. So with that, we've been making a significant investment in new equipment, looking at different and more efficient ways to do that work. We're anticipating about a 30 to 40% increase in our daily needs. But with that, one of the things that we've made a significant investment as well is creating what we are calling like sanitizing stations. So every classroom and all main offices and high traffic areas will have these sanitation stations that will include hand sanitizer, and then disinfectant in a spray bottle with special microfiber cloths that any person or any staff member or adult would be able to use. We've been making a significant investment as well as we can get access to the purchase of hand sanitizer. As I said, every classroom will have hand sanitizer, every main area will have hand sanitizer. We've purchased almost 3 full truckloads of hand sanitizer so far because we anticipate that this will be a need for quite a while. In each of our cafeterias, we are putting up mounted hand sanitizer stations so that if we do have in-person dining in our cafeterias, before a student would go through the lunch line, in each of those lines, there will be a hand sanitizer station that they will be expected to use before they get their food. So absolutely, we are evaluating every day with our custodial vendors, supplies, different types of cleaners, how we can do this more efficiently and keep up with the daily needs.
Thank you. Mrs. Woods, some high ability questions. Well, this one's specific to virtual. Will there be a high ability or Excel option available for students who choose virtual?
Yes, there will be high ability for virtual, just as there is for our all of our exceptional learners, special ed, and EL. So that should not exclude somebody from choosing virtual if they want to do so.
Great. Going back to Mrs. Griffin, another virtual component, and I apologize, it's probably the way I communicated this. Virtual, someone asked, is virtual only 9 weeks? So what's the difference? How long will that virtual option be available? And what was Mr. Russell talking about when he said 9 weeks?
Okay, so the virtual option is going to be available for the entire school year. The reason we're asking for a 9-week commitment, because that gives us an opportunity to make sure that your student has a full 9 weeks of instruction and a grade to transfer back to their home school. This will be very important for all of our students, especially our high school students who are in credit-bearing courses. It would be very difficult for a student to start in a virtual classroom or a face-to-face classroom and make a jump to any school or any program, whether regardless of where you are. And so the 9-week commitment is so that we can make sure that foundationally, you've had 9 weeks of consistent instruction. And when you are returning to your home school, we just want our families to know that returning home is always an option. And so to your home school. And so completing a 9-week successfully and having a letter grade to transfer with you allows us to make sure we schedule you properly and that your grade can be combined with the second 9 weeks or the next 9 weeks grade, so you have a semester average. And so the same would apply in our thinking if there was to be a transfer after a 9 weeks. And so I hope that clears it up. This isn't just a 9-week program. We will be offering it for the entire year. We just know that for some families, starting for the first 9 weeks may make the most sense for where they are right now. And we want to be able to provide that opportunity for them.
All right, continuing to look on here. A lot of questions about when the official return to school work plan. Dr. Hanson, if you'll allow me to address this question to you. Where can I find additional information about Warren's reopening plan? Some questions about just some more specifics, and then what a potential timeline. I know we addressed that at the beginning, but do you want to address additional information, frequently asked questions, and just timeline questions at this point?
There was one scenario that I want to make sure is clear. For a student who they selected the in-person option and they're required to be quarantined for 10 to 14 days. They will then go into the e-learning mode. And I apologize, Mrs. Griffin, if you mentioned that, but I want to make sure that that's clear. If a student has to be quarantined because they contracted COVID or they were exposed to somebody who contracted COVID, they will continue to receive their instruction through an e-learning model with their current classroom teacher through the Seesaw and Canvas that Mrs. Griffin mentioned. If a student is in the virtual model, then that's where the 9-week expectation stays in place and semester for the high school for those semester classes. To the question of when our safe reopening plan will be available, we know school starts 4 weeks from tomorrow. We know that Indiana and Marion County are not yet in stage 5. So a lot of these plans and actions are being created in hopes that we will be in stage 5, both in Indiana and Marion County, by July 29th. July 29th was always our designated start date due to Warren being on the hybrid calendar. So there was a couple questions of why we were starting so early. That was our designated start date to start with. So it's my hope that we will have the safe reopening plan no later than July 15th. We do have a couple more work sessions that we plan on filtering the information through and getting feedback from teachers and staff and families. But no later than July 15th is when we will have that posted.
Thank you. A few final thoughts that I want the opportunity to communicate. Obviously, additional details were gathered tonight from students, parents, communities, and staff within the conversation. We have several additional questions that we know we have not answered, or some specificity to those questions that are still required. By registering for this webinar and submitting that question, we also have the ability to contact you and to also additionally make sure that we explicitly address those within our reopening plan. We do have plans to take additional feedback from both staff and the community specifically. We are planning an additional community survey to ask for some additional feedback from the community, and what thoughts and processes based off our reopening are with some current things that obviously not only we have discussed tonight, but that we'll continue to communicate. I do want the opportunity to speak directly to staff and any Warren employee that's listening here tonight. We also have plans to have a staff-specific webinar, 2 of them in fact, on July 14th and July 21st. More information will come out about that, but those specific times that we can get into some more specifics relevant to employees. We look forward to the opportunity to engage with you guys as well with that. Trying to think what else I wrote down. Then, first and foremost, we're sharing the information, our thought process, and the significant work that has been put together by over 100 task force members, specifically that constitute people that are both watching and participating in this webinar. And as that information continues to come in and whether it's changed or being confirmed or reaffirmed, we're committed to continuing to communicate that information to both staff, community, and as quickly and as appropriately as we can. I will leave the chat feature up so people can put additional questions in that at any time, and you can always reach out to us through those traditional channels or send additional questions in as we start to not only review and process those, but inform our plan as we move forward. So at this time, I'm going to allow any panelists, if they have any final thoughts or anything that they want to communicate to our audience. And if not, we're going to wish everyone a good night and a wonderful evening with the information that we have recorded this session, and we will be posting it to our website for people to review whenever they would like. Dr. Hanson, President Burke, any final thoughts?
Yeah, I just want to say thank you before I turn over to President Burke to close us out. Obviously, there are a lot more questions than answers right now, and I think all the questions that were presented prior to our webinar have helped us guide tonight's information. The questions that have been submitted during the webinar, we will answer those. We will post those on our website under an FAQ. Please allow us some time, particularly with the 4th of July weekend coming up, that we may post those coming up on July 6th. So thank you for participating. Thank you, panelists, for all the work that you have done and will continue to do as we prepare for a safe reopening. And President Burke, if you could close us out, please.
To everyone who's participated and watched today, I want to thank you again. And I want to acknowledge a few things. One is that you have been given a ton of information that needs to be processed and that you will have questions about. The other is, and especially as a parent, I feel this, that regardless of the ton of information you have just been given, you have a ton of questions about things that were not answered in the ton of information you were just given. We know and we acknowledge that. There are details that we need to work out. There are things that are still changing every day, if not every hour of the day. We will get those details to you as soon as we know them and as soon as they are figured out, with the knowledge that you need to understand that the coming school year will require grace and flexibility of all of us. There is no information I can give you or any of these panelists can give you today that is not subject to change in 3 to 6 months or tomorrow, to be quite frank. That is just how it is going to be for this year, and there needs to be an understanding for all parents and all students and all staff that that flexibility is just going to have to be something that is expected, but still very appreciated. The administrative team and the conversations that I have had with them, they want what is best for the district. They want what is best for their employees. They want what is best for the students. And that requires making a lot of difficult decisions and then thinking through something for weeks and having it changed on you. And so that is a consideration and something that we will continue to do every day, is to work through the best possible scenarios. I want to comment on something that a couple of our panelists said. As Mrs. Wood said, this is going to be a large change for a lot of our students. I mean, we haven't eaten at a restaurant in 5 months. My kids only leave the house to like walk around the neighborhood and occasionally do things. And they're about to get thrown, my middle child's about to get thrown into the high school. And there really will be a shock there and a change of climate. Mr. Clayton mentioned that we're about to enter a culture shock that we're going to have for the rest of the year, and he is correct. And Mr. Shepler mentioned that this was unprecedented times. And we are here to support all of your students and all of your staff and all of the staff through all of these things, through going from never leaving your house to all of a sudden being at a high school with, we're not sure how many students, somewhere between 2,000 and 3,500 students wandering the hallways. And it's scary, and I want to acknowledge that. I know that every time I read the plan there, especially as a parent of a high school student, there's kind of a catch in my throat that, oh, my kid is going to go to the high school and there are going to be a whole bunch of people there. That is a reasonable way to feel, and we want to acknowledge that, and I want to acknowledge that. And that is the reason that you have options as a parent, and those options include a virtual education that we and members of the task force have spent a very long time making sure will be robust and a quality education for your student, as well as an in-person option. There is no judgment in which of those you choose as a parent. You need to pick what is best for your family in your particular circumstance. And please do not feel that anyone is pressuring you one way or the other. As a parent, you need to pick what is best and to do that. I would like to thank you again tonight for being here. We have over 100 questions that haven't been answered, so we understand we have work still to do. Thank you for your patience. Thank you for your willingness to communicate with us. Your questions and concerns. Allow us flexibility in the time we need to get back with you. And know that every day, everyone on this webinar and everyone in the district really is doing their absolute best to give everyone a quality, safe educational experience this next year. So thank you so much. Thank you for all of your time. And have a good evening.